Welcome. My name is Dr. Adam Rana, and I'm an orthopedic surgeon with Maine Medical Partners, Department of Orthopedic Surgery. I welcome you to our physical therapy program. This is a program that's going to be headed by Erica Egler, one of the physical therapists at Maine Medical Center, where she'll go over 8 knee-related exercises to be done before surgery to give you an optimal recovery and outcome following your knee replacement surgery. I hope you find this video helpful. Thank you.
Hi, I'm Erica. I'm one of the physical therapists here at Maine Medical Center. Janet and I are going to go over some exercises that'll help get you ready for your total or partial knee replacement. Please do these exercises on both of your legs before surgery. If you are unable to do the exercises on your bad leg due to pain, please exercise your strong leg. Always speak with your surgeon before starting any new exercise routine. So I'm going to have Janet scoot back on the mat a little bit. These exercises we're going to ask you to start with 3 times a day, 10 times a piece, and from there you can progress up or down depending on how your body tolerates it. The first one is a warm-up. What you're going to do is you're going to do some ankle pumps. So you can be gently flexing and pointing your toes. You're going to do this about 30 times or 30 seconds, whatever's comfortable for you. This can be done either laying down or in the seated position. This is also going to be important after your knee replacement as it helps prevent against getting blood clots. The next one is an exercise for your quadriceps muscles, or the big muscles on the front part of your thigh. So what you're going to do is you're going to be on a bed or a mat. You're going to be pushing down the back of your knee into the mat. So Janet's kind of squishing my hand into the mattress. Hold for approximately 5 seconds and then relax. Yep, again, and relax. You can think of this as pulling your kneecap kind of up towards your hip bone. You can also roll up a washcloth or a little small dish towel if you find it uncomfortable. So you're gonna hold for 5, and relax. Scoot back even a little bit further for me, Janet. The next one, we call these heel slides. What you're gonna do is you're gonna keep your heel planted on the mat or the bed. You're going to gently bend up your knee to a comfortable position and then push that heel forward. You don't need to hold these ones. It's a gentle range of motion. You do 10 on each side and then alternate to the other leg. Make sure your knee stays in a straight position. You don't want that leg to flop out towards the side or cross that midline. Very good. The next one is called hip abduction, or sometimes we'll call these snow angels or windshield wipers. What you're going to do is keep your toes and your knee pointing towards the ceiling. You're going to keep that leg nice and straight and slide it out towards the edge of the mat. You can either do these at the same time or you can do one at a time like Janet's doing right now. Be careful that you don't turn those toes out and pull with the front muscles. You want those toes pointing, and the toes and the knee pointing up towards the ceiling. Very good. The next one is called short arc quads. We have these nice fancy bolsters here. At home you can simply roll up a towel or a pillow like we have here. You could use a paint can or a coffee can, anything will suffice, a yoga mat. You're going to keep both knees on the bolster, keeping the back of your knee on. You're going to squeeze these quads in the front, straighten out your knee, and bring that foot back down to the mat. You want to make sure that you have good control on the way up and on the way back down. You don't want that foot to flop down to the mattress. Ten on each side, alternate legs. Very good. Slide that out. These are called straight leg raises. What you're going to do is you're going to bend up one knee. Sure. What you will want to do is that very first exercise we worked with, you're going to do the quad set. So you're going to tighten up those quad muscles in the front, keeping your leg nice and straight. You're going to lift the whole leg, even to the other leg, keeping those quads tight. When you hit the mattress, you're gonna relax. Retighten, lift the whole leg, pause at the top, come back down, relax. Very good. Then you'll alternate legs, bend up the opposite leg. It's a little easier on your back. Tighten, lift, lower, relax. These are a bit more of an advanced exercise, so you can start with 5 on each leg and see how your body tolerates that. These last two, I'm gonna have Janet come right to the edge of the mat. At home, you could do these seated at the edge of your bed or in a kitchen chair. You'd like a smooth surface to be able to slide your legs on. So what you're gonna do is you're gonna sit at the edge of the mat, keeping your foot planted. You're gonna pull that foot down behind. There you go. And then you're gonna push forward till you have a nice straight leg and pull back and forth. On each side, alternating legs. And the last exercise we're gonna do is called a seated straight leg raise. What you're gonna do is keeping one leg straight, you're gonna tighten those quads just like we did laying down. You're gonna lift that leg, come back down to the mat, or to the floor. Very good. You can also elevate your foot on either an ottoman, a coffee table, or a footstool and lift from a already raised position. So again, like we talked at the beginning, we're gonna ask you to do these 3 times a day, 10 times a piece, and work up from there.